Good morning. Happy Saturday. I am Dr. Malea Jensen. This is live Q&A with Dr. J's Prescription for Health. So welcome everyone. We'll wait for everybody to get started here, but if you are listening right now, please let me know where you are listening from, what city, what state, what country. Let me see here. We are live on Instagram and we are live on YouTube. This is my co-host. This is Tucker. Tucker is co-hosting from heaven. He has a heavenly birthday coming up in February. It has been a bit of a rough year without him, but knowing that he is helping me and co-hosting it's a relief. So that does help, knowing that. All right, you guys. Good morning, Melanie and Ruth is listening from Arizona. Where are you guys listening from? What city, what state, what country? If you already or haven't already, please like and subscribe to this channel. I thought we would go through, I've wrote some things down to go over, maybe to get you guys your juices flowing, see where you want to go with today's live stream. We are live on Saturdays at 9 a.m., Sundays at 10 a.m. on Central Standard Time. So, all right, you guys. Doesn't look like we have any questions going on right now, so we will start with asking you guys your thoughts in regards to the new dietary guidelines, the United States dietary guidelines, and the new food pyramid that basically got upended and flipped on its head. All right. What does that mean to you? Does it mean anything? Is it going to change the way you go through life? You know, is it going to change your diet, change your lifestyle at all? If not, you might not even know about it. But yeah, about 4 days ago, I think now, the United States dietary guidelines changed. It changes about every 5 years, or it stays the same about every 5 years. But available. I am from Iowa. So we are live, and so we're in Central Time. It is 9:03 here. So where are you listening from, you guys? No one wants to tell me, but Ruth, Arizona. I also think with the changes of the food pyramid, it's going to maybe change a little bit about, I think fat might become more important, but I'm not sure. And the reason I say that is because I think there are still doctors, even, mainly cardiologists, who are still on board with polyunsaturated fatty acids in the form of seed oils. Good morning, Virginia, North Carolina, and John is from Wisconsin. And available is from India. Kenneth is from New York City. Gosh, I haven't been there for a long time. I do enjoy New York City at Christmas time. That is for sure. That was about the only time I like to go. I mean, I like to go anytime, but that was a really favorite time for me. So with the seed oils, and there's the terrible 8 that we know as the 3 S's, the 3 C's, and rice bran and, rice bran and grapeseed. So 3 C's, cottonseed, corn, canola, the S's, sunflower, safflower, soy, and then cottonseed, and then rice bran and grapeseed. So those seed oils have been promoted for maybe cardiovascular health because it lowers LDL. Now, I will tell you, and I have in the past, that my problem with seed oils are that they contain double bonds. Polyunsaturated means they're not saturated. They got many unsaturated double bonds. So they have areas, double bonds, where oxidation can occur. When those seed oils incorporate themselves, those polyunsaturated seed oils incorporate themselves inside the membrane of an LDL even, or your cells, or red blood cells, they can get oxidized. So they can be damaged. So now you're damaging the cell membranes of red blood cells, LDLs, your fat cells, any cell in your body that has incorporated polyunsaturated fatty acids that can stay in our body for 2, 3, even up to 5 years, I think that is an extreme negative. And if we keep hanging our hats on the fact that polyunsaturated fatty acids lower LDL, LDL is way down the list for causing coronary artery disease. But if we have cell death, we have diabetes, we have insulin resistance, now we're talking about causes of heart attacks, brain attacks, which are strokes. Diabetes is the #1 cause of cardiovascular disease. It's not LDL. And if we're going to talk about LDLs, we're going to talk about the small, dense LDLs, the ones that have been oxidized, the ones that have been glycated. Yeah, I'm a believer that LDL is bad if we're talking about small, dense LDLs. Otherwise, I don't think LDL is as relevant as doctors say it is, okay? And I think the fact that we have tipped over the pyramid is going to be indicative of the fact that saturated fatty acid saturated fats are not a problem. The fact that plants have fake cholesterol, they're called phytosterols. These phytosterols, I think, are dangerous. They interfere with normal biologic processes that occur in our body that use cholesterol. So phytosterols are not something that humans, mammals, can use. If they try, it's going to disrupt the normal biologic processes that do require hormones. That do require cholesterol, like hormone production. Our body is actually trying to reject phytosterols, plant sterols. It's not cholesterol, but it's a fatty sterol. And when our body it's not able to reject all of them because we eat or consume so many of them, it gets incorporated into our tissues, like I just said, and our arteries, in the cells of our arteries, which I might have failed to mention, but those are cells, endothelial cells in the coronary arteries that can take up these phytosterols, these polyunsaturated fatty acid seed oils, and cause premature cardiovascular disease. Premature cardiovascular, not heart protective at all, but increasing our risk of cardiovascular disease. And you put that in combination, you're usually eating seed oils in combination with high carbs, high sugar, the glycation. So now you are causing extreme amounts of oxidation, extreme amounts of inflammation, glycation, oxidation. It's just, I believe that is why cardiovascular disease is so prevalent, why Alzheimer's is so prevalent, diabetes is so prevalent. We're looking at all the wrong things. Is that an agenda? Maybe. If you think it's an agenda, then reverse it. When seed oils incorporate themselves, when these seed oils, these polyunsaturated fats, these omega-6, by the way, we do need omega-6. They are essential. We don't need them in the amount that we're getting. There is saturated and polyunsaturated and monounsaturated fats in all things. They're not just one or the other. Some people will say, oh, I'm not going to eat animals because it has no polyunsaturated fatty acids and we need those. No, it does. It has omega-6. Cows have omega-6. Cows have omega-3. They're all there. They have them. So there's also monounsaturated in cows. So even a plant is going to it won't have saturated fat, but it's going to mainly have polyunsaturated fat. Now, when these seed oils, these phytosterols, get incorporated into a red blood cell, think about all the places that red blood cells are significant. Delivers hemoglobin, which delivers oxygen. I mean, what if your brain doesn't have oxygen, your heart doesn't have oxygen, any tissue does not have oxygen? What happens? So if phytosterols can get incorporated into a red blood cell membrane, it causes destruction of that red blood cell. just like it causes destruction of the endothelial cell of the lining of the arteries. But I look about the red blood cell, and early death of red blood cells is significant, you guys. And by the way, you know, we hang our hats on checking for diabetes, right? And we hang our hats on, good morning, Lucy. Thanks for being here. Lucy is one of my blue wrenchers. She'll be helping with moderation, as is RM. They're both on board right now. And good morning, RM. Thank you for being my blue wrenchers this morning. It helps me tremendously keep up. So back to the red blood cells. If you get an A1C, the A1C, you're checking for diabetes, right? There are many things that can cause destruction of red blood cells. And if the red blood cells are dying faster than a normal 100 or 120 days, then that A1C, hemoglobin A1C, can actually be lower. It can be falsely low. So if we are eating a lot of processed foods or eating a lot of canola, corn, cottonseed, sunflower, safflower, soy oils, soy fats, we are going to be incorporating these phytosterols inside of the red blood cell membrane. That causes oxidation of that red blood cell membrane. It destroys the red blood cell, and now those red blood cells are dying off sooner. That is going to distort the accuracy of a hemoglobin A1C. Okay? That is not good, because we're getting a fake sense of security when our A1C is low, when most doctors should be able to look at a person and know whether or not they have diabetes or insulin resistance. There's some obvious signs. Alcohol can disrupt red blood cells. Smoking can disrupt red blood cells. But we need to know all of these things instead of our doctor just simply telling you, oh, your labs look great. Do I have diabetes? No, your A1C is like 4.9. It's awesome. Yet you have skin tags all over your neck. You got a big belly. You're fatigued. Your triglycerides are through the roof. You know, it's a shame, really, that doctors don't know more. But hey, maybe they just don't have enough time. Maybe they are seeing so many patients during the day in 5-minute slots, they just don't have enough time. Is that the kind of doctor you want? The one that doesn't have time? The one that's seeing 40 patients a day? Just like in an assembly line? I think you guys are smarter than that, and I think that you don't want, yeah, I agree. Adriel, their doctors, they do like to dispense medications because that's what we've been taught. When a doctor is commended for making a good diagnosis and prescribing the correct, what they say is the correct medication, there are, it's almost like a pat on the back. It's like a warm fuzzy. Okay? It's an incentive to continue doing it. And so if your pay by an insurance company is incentivized by you making a good diagnosis and you putting that patient on a correct medication according to guidelines, you're going to continue doing that. It's until you jump out of the matrix, so to speak, and your eyes start to open and say, hey, we're just making a diagnosis, but what are the causes of those diagnoses? They're really not diagnoses. They're actually symptoms of something deeper, and we're not looking for it. Roadrunner says, anymore, anyone can be a doctor. Well, if we are promoting doctors and waiving college fees, college tuition, in order to get more doctors on board, do you want those doctors? When I got done with medical school, the incentive to be a good doctor I had to pay back that loan. And so I was not given a free ride. But if we give people a free ride, you're right. Anyone can be a doctor. The standards of becoming a doctor, because we're in a shortage, now become lower. And if you waive their fee, they really have no skin in the game. You know, if you pay for something, you get some skin in the game. You're going to want to be better and you just take pride. But what if I gave you something for free? You don't have to really work for it. Do you really take any pride in that? I mean, maybe you do. Maybe I'm just painting a big, broad brushstroke and I shouldn't be. But, those are the things that I think about when we say that we have these doctors that are shortage of doctors. Seriously, why is there a shortage of doctors? Are they getting burned out? Are they sick and tired of being told what to do, following some guideline just because they don't want to get sued? And people are still getting diabetes. They're still having heart attacks. They're still getting strokes. They're still getting dementia. And at the same time, the pharmaceutical companies are pumping out more and more drugs for the doctors to prescribe to the people. And it does not appear to be helping, does it? Because cardiovascular disease is still the number one cause of death. Right? Is it helping? It doesn't appear to be. But maybe flipping the pyramid on its head will help people see that what they've been eating might have been causing their diabetes. And if they reverse it, start eating from that, what was the bottom of the pyramid, flip it, and we say, maybe we should be eating more whole foods. Maybe we should be incorporating more meat and more, I hate to say that, but yes, more whole foods, including animal-based diet, okay? They didn't take plants out of there. So for you plant people who are, having a conniption, I would say, John, I don't like that kind of talk. So, I guess I don't need that kind of stuff going on here. I'm going to help my moderators here a bit. We're here. Everybody is here that wants to be here because they want to learn. Okay? So if you have a question, put a Q in front of it and we'll go from there. But I don't need derogatory comments. And, it just makes the blue wrenchers have to work harder when they probably want to, sit and listen and learn as well. MJ asked, do I know Dr. Hulda Clark? I do not. She died after her cancer protocol was made public. I do not know her. I don't know what cancer protocol we're discussing, but that's sad. I would wonder what the cause of it is. Is it whatever protocol or is it something else? Sometimes. Touch of Wood says, God bless from Dothan, Alabama. Good morning, and God bless you as well. Thank you for being here. Linda asks, thank you for being a blue wrencher. So I got 3 blue wrenchers here this morning. Is there a way to prevent sebaceous cysts? Any type of skin disorder can be linked to diets, okay? And, usually those cysts occur in areas where we have scars, in areas of high fat places, but usually you can chalk that up to high seed oils and high sugar diets. So that's how you can prevent them. Once they get under the skin and they wall themselves off, the cyst sac is hard to penetrate. So a sebaceous cyst that is, all of the keratin and the debris and the bacteria sits inside of that cyst sac and it walls itself off, and it's hard for the antibiotics to penetrate that. So a lot of times you have to have a general surgeon, or, when I did these things, even as a family practice, but I would want somebody who's done a lot of them. I wouldn't want somebody to cut into my skin who's never done a lot. And you have to really kind of dig that shell, that cyst out of there so it doesn't keep filling up. Okay. You can squeeze them and do all of that, and all of the stuff, the inner contents that's in them comes out, but the sac is still there. So they just fill up. It could be a month later, 6 months later, but they do usually tend to fill back up. Patrice says, what are your thoughts on nutritional yeast? I try to add it to my food daily. Why? What is the, no, I guess I don't have any thoughts on nutritional yeast, but why would you try? So trying means you have to think about it, or, try to me is you're probably not going to do it. So if somebody says, Dr. Jensen, can you come to my house for dinner tomorrow night? And I say, what time? And you say 6 p.m. And I say, I'll try to make it. What does that sound like to you guys? Does that mean I'm going to either be early, be late, or not show up at all? That's what I think about that word try. So when somebody says, well, I try to add it to my food, what does that actually mean to you? Is it just it's just a figure of speech? Or, because when people use that try word to me, it doesn't mean a whole lot. So maybe rephrase it, Patricia. I don't know exactly what you're using the nutritional yeast. And when you say try, does that mean you're using it every day, or you're using it once a week, or what? Okay. USA, thank you. You're very welcome. Thanks for being here. I appreciate it. You guys, if this is, if you have not subscribed, or if you've not clicked the thumbs up, please do so. It does help the algorithm. It helps people to see the information I'm providing. If you're here, you likely find there's value to it. If you're not here, you likely don't find value to it, or you don't know about me yet, which is more likely. RM, I'm not sure that I can answer your question of a bone marrow biopsy. You'd have to ask, I would ask you, why are you having a bone marrow biopsy? And if that is the only way that you can get an accurate diagnosis. The cons is any time that you insert a needle anywhere, you can insert infection. And so there's always risk of infection with any type of procedure or surgery. Hi, Babs. Good morning. I sprinkle it on my food because of my lack of intake of meat and other foods. Patrice, I'm not understanding why nutritional yeast could replace the most nutritionally dense food on the planet, which is meat. I don't know what other foods means to you, but again, I'm not sure what nutritional yeast could do for you that meat absolutely can do for you, okay? Let's see. Aussie, that would probably be a question that you would need to talk to your urologist about. Okay? But I'm guessing that probably is not normal. Okay. All right, Babs, thank you. Vitamin B1 from nutritional yeast, because meat is a good source of B1. Again, from my perspective, it seems like I would just eat meat, but I know that Patrice probably does not want to do that if she's actually trying to avoid it. And if she wants to use nutritional yeast for her B1, go for it. Chrissy says, is deli meat bad for high triglycerides? If deli meat is processed with sugar is a source of high triglycerides. How about that? You guys over on Instagram, if you notice, there is a live fundraiser for Rescue Rehab and Rehome. That's where I got my, I don't want to wake him up, but that's where I got my TALLOW, my Norman TALLOW. And so it's a rescue in central Iowa. Okay, so you will see I do this once a month. I try to raise $100 for them once a month. And it looks like we have 9 days left, and we're sitting at about $28.31. So if that touches your heart and you want to help that rescue, who I find to be, so far, I find them to be very legit. They did very well. Patrice, thank you so much for the super chat. I appreciate that. And I know that it is very difficult to listen to somebody who leans more animal-based like myself. I personally have chosen not to eat plants. That doesn't mean Patrice doesn't, that you don't, or I'm not telling Patrice not to eat plants is what I'm trying to say. What I'm trying to do, for those of you who don't know, but I'm actually trying to provide you with information that you could make good decisions in the future. Now, some people, even with the amount of information, don't necessarily want to make changes in their diet or their lifestyle in general. And I'm okay with that. I think what I'm not okay with is when a person says to me, I didn't know that certain LDLs were worse than other LDLs. Well, because you weren't given enough information, you could never make a good decision. And so if people love to live in bliss and they live in a tunnel, they're never going to get any other information. They're never going to get any other experiences in life. They're going to be like a robot. They're going to be indoctrinated. They're going to be brainwashed. But until we are able to see different sides of an equation, it might allow us to make a different decision. How about that? Patrice says, I am trying to make changes from your advice. I threw out the blueberries this week. Well, maybe you could have just eaten them, and then I'm, as much as I don't eat blueberries, it's hard for me to have anybody else waste food, only because I know that there are people starving, but it's already done. And sometimes that might be the best way for people to not ever go back is, I'm going to throw them away and I'm never going back to these. Okay. And that's great. You bought 2 steaks. So Patrice is on a roll. She got rid of her blueberries and she bought 2 steaks for the week, I'm guessing. Did not buy any vegetables or fruit. So Patrice, that brings me great delight. I want to admit that, okay? That makes my heart happy. But I need you to not do that for me. I need you to do that for you. I need you to, or I want you to actually see the benefits in 30 days. Like, what are the benefits to you in 30 days? I listened to something not long ago where this person went mainly carnivore, and they had a whole list of things that were wrong with them. Diabetes or insulin resistance, high blood pressure, fatigue, brain fog, obesity, all of these things, right? And there must have been 20 things listed. And they went carnivore, and all but one was not fixed or not corrected. And they asked this podcaster, should they go back to carbs or add back some more carbs to fix the one thing? They took out carbs and 19 things were either improved or reversed. One thing wasn't. And the first thing that came to their head was, maybe I should add back carbs. There are influencers out there who, since the food pyramid was turned upside down, that you should not eat any fat. And because they told you not to eat fat, it's almost like by turning the food pyramid upside down, people are going to race to the store and buy Wagyu beef steaks and get all of this saturated fat. So there's just been a rush for people to think that they don't need fat, or, oh my gosh, they turned the food pyramid upside down, and if I go start eating steaks, I'm going to get too much fat again. Oh boy. The problem arises when we don't eat fat and we eat a carnivore diet. That is a problem. because we can get a situation of what they call protein poisoning, or I've heard it be called rabbit starvation. You could have called it lean chicken breast starvation as well. When a person does not eat any fat, and honestly, I've been guilty of this. When I was bodybuilding, my diet for 16 weeks was completely void of fat, except for MCT oils. And it is likely that for those 4 months, that's 16 weeks, I had protein poisoning. I was eating upwards to 200 to 250 grams of protein a day in the form of tuna and lean chicken. And that can cause protein poisoning because there's no fat. Fat is like a buffer. Fat buffers that protein. And for the most part, you guys, a carnivore diet, if you were to talk to anybody who talks about a carnivore diet, most everyone is on board with the fact that high amounts of fat is necessary and moderate amounts of protein is preferred. Upwards to 80% of your carnivore diet should be fat. You're looking at a 1-to-1 or upwards to a 2-to-1 ratio of fat to protein. That is healthy. A all protein diet, one, you're going to be very hungry. The satiation of protein alone is not very high, okay? But you add fat and your satiety is much it's improved. So you get fuller faster. It keeps you full longer. Satiety, okay? Carl, are you asking a question or are you just making a statement? I'm not sure. Let's see. Let me go back and see if I missed any questions. John says this is really good. And John says what is confusing is that this past Tuesday he had wait. He went to they went to the oncologist. He had an 8 to 9 minute face-to-face for his first meeting because he's got cancer, a diagnosis of cancer. The amount of information that was given to John in regards to his cancer in 8 to 9 minutes, John says was staggering. And I'm guessing when you say staggering, it means overwhelmed. You were overwhelmed with the amount of information. What I would suggest to anybody, no matter what doctor you go to, if you walk out of there after an 8 or 9 or 10 minute or 5 minute conversation with your doctor, I suggest you request the progress note for that day. The progress note that the doctor has to put in your chart. Request a copy. You might have to stay and wait or return the next day and get a copy of that. So it will be written down for you, John, what he talked about. In fact, you might find out that he didn't talk about any of that stuff, but yet it was still in your chart note. It's called a template, and we just click a button and the template pops up. Whether we talked about any of that stuff or not, it is there. But John, that might help you. Look up things that he or she brought to your attention in regards to your cancer over an 8 to 9 minute. You need to gather as much evidence, as much information as you possibly can. And also another way to do this is maybe taking somebody with you who can take notes and make them go slower. John, it is not your responsibility for them, the doctor, putting 40 patients in their schedule. But what they are responsible for is your healthcare. You scheduled an appointment. And so if it takes 10 minutes or it takes 20 minutes, you should be given the opportunity to ask questions. If it puts him or her behind, you are not responsible for that. You are only responsible for you and your questions to the doctor, okay? Likely that doctor will dismiss you. They will seal your lips and tell you to make another appointment. And so if that is the case, then you request a 20 or 30-minute appointment because your doctor did not give you enough time to answer all of your questions, okay? And if they refuse to do that, you say, you know what? I might take this to the board and just let them know that you're scheduling appointments for which they're all life or death situations, but cancer is kind of a more life or death, as is a heart attack or a stroke or diabetes or anything like that. But, you know, these are situations where usually the doctor is put in a predicament that they are being forced to see a certain amount of people over a day's time because it makes money for the clinic. And when it comes down to it, John, it wasn't about you. It was about the pocketbook for everybody involved, okay? Yours was emptying and the other people were filling their pockets up. Let's see. If you have a question, please put a Q in front of it so I can pick it out readily. Otherwise, much of this is simply just statements. Mood elevator shared you out. So, okay, everyone needs to listen to medical truths. Thank you, Mood elevator. I appreciate that. Like I said, if you have not subscribed, just go look and see if you've subscribed. Click the thumbs up button. Click the like. It does help. It gets the information out. You're very welcome. Thanks for being here. Thanks for sharing. What is my favorite book? What is my I have many favorite books. I think the book that might have got me out of the matrix more so than any other book at the time. And even I'm talking about what got me into the position I am today from the position I was 4 or 5 years ago. 4 or 5 years ago, I was probably a typical doctor. I was very in tune to preventative medicine. However, I was very in tune to making a diagnosis and giving you the accurate medication for it. Because in my head, I felt like you were not going to make a change in your lifestyle, even though I knew that would help and you wouldn't likely need much medicine, if at all. But what I did is I gave up on you. And that is very typical of doctors when they know what will make changes. I'm very well versed in what will make changes as far as preventative medicine is concerned. But I gave up on you guys. And I made the diagnosis and I gave you the medication. The book that might have popped me out of that matrix was a book called, it was by Nina T. Coates. And it was, oh my gosh. Help me out, you guys. It's on the tip of my tongue. Something about fat. Oh, goodness. Yeah, Nico, you're very welcome. Nico says, at least you're honest. I think honesty is the best policy. And at times, honesty can get you in a lot of trouble. Lack of honesty can get you in a lot of trouble, and being overly honest can get you in a lot of trouble. And it's been a downfall of mine because sometimes people don't want to hear honesty. They don't want to hear truth. They want to be deceived. And that is what they're getting when they go to the doctor. Cadence, sorry. Who gives your schooling their funds? Who gives your schooling their funds so they write what you're being taught? Am I wrong? I think I know what you're talking about. Our curriculum is underwritten usually by pharmaceutical companies. That has been the tendency, even private schools. I went to a osteopathic school, which in essence is more of a private, it's not university, although mine is now. Mine is now Des Moines University. They were the University of Osteopathic Medicine and Health Sciences, and it was more of a private school, a private osteopathic school, a private PT school, a private PA school, and not so much anymore. But the government funding of those now universities makes it easier for the curriculum was always the same. It was always underwritten by pharmaceuticals, and it just depends on, who gives, who the government is supplying as far as lobbyists with their, it's kind of a license to continue writing the things that we learn. And every CME, continuing medical education, which we are required to maintain our license, we're required to do, it's telling how we as doctors can be in a tunnel vision and never get outside of the I want to keep calling it a matrix, but just to have our eyes open to other things. And we're not able to do that because they manage our time. And once we get out of the office, we got family. We got other things we got to do. So we basically see patients, we get behind on charts, we click buttons to get the chart done so we can make money. It is what it is. Not every doctor is going to be like this, you guys. I don't want to paint a big, broad brushstroke, but I'm going to say majority, okay? Majority. It's not like Little House on the Prairie where there's one doctor in the town and he comes house to house with his black bag and takes his time with you and answers all your questions. It's not like that anymore. This is, maybe when I started 27 years ago, it was more like that. I really loved medicine. And then it got more and more miserable until the last few years when I changed how I practice medicine the last 4 years, and even going to an all online consultation, because now I'm just seeing people who want to come to me, and they're not required to come to me by their employer or the government or whoever it is, because that happens. In order to get your HSA and get some a Visa card, your incentive, go get your physical. When you see an online doctor and you don't use your insurance, yes, it comes out of your pocket, but yes, you're getting an hour's worth of my time or more. I mean, I've had patients, or not patients, but clients who have scheduled time with me, and I never go back to back on my clients because they could last 90 minutes or 100 minutes. I'm not going to cut them off. If they want to cut off, they don't want to spend the money, because it is right now $110 an hour. Some people say, hey, doc, I'm going to keep this to 45 minutes because I only got whatever certain amount of funds. And I say, okay, you tell me when to quit. But at times, these conversations can go 60, 90, 100 minutes, and you're getting your questions answered. And to them, it's worth spending $150. Okay. XQ says they overcame Lyme symptoms by going low carb. So Lyme is a bacteria, right? And what do bacteria eat? They eat the food that we have in our body and we put in our body. So it seems that XQ overcame Lyme symptoms by stop feeding it. If you go low carb, you likely got rid of some seed oils and you likely got rid of some sugar. So now you're seeing that all pathogens, whether it be viruses, bacteria, parasites, fungus, they all eat sugar. They consume iron, which is heavily overloaded in our body. And XQ has no symptoms from their Lyme by going low carb. That's just one thing that XQ probably solved the mystery. Vita, it sounds like you might want to ask that question to your doctor who's on, Vita is on amitriptyline and propranolol. So I don't know why you're on those medications, but you need to talk to your family practice doctor, I'm guessing. Sounds like the one, yeah, we don't deal with any questions like that. So you guys, I have moderators on here for a reason. You know, I will be happy to answer your medical questions. As a physician, family practice physician for, you know, I will, but I'm not going to get into your religious problems or your political problems or your financial problems, although that does affect our health. But if you have a question in regards to your health, I'll be more than willing to see if I know the answer. How about that? So if you do have a question, put a question mark in front of it. If you want your question answered faster, do a super chat. That's what those are for. And they help me. They help me keep this going. I will go. I'm going to continue to go, but it, you know, everybody loves a bone being thrown at them, and know that it validates me that, okay, you guys find value in the stuff I'm offering. And that means a lot to me, that you say, you know what, you're worth $5, you're worth $10, you're worth $1.99. It, you know, even a quarter tells me that you had to think about putting that in there. You know what I'm saying? That you thought, you know what, Dr. Jensen's pretty good, but she's only worth a quarter today. Pam says, I keep waking up at 1 a.m. and I can't fix this. Any advice? Pam, I would probably need a lot more information. Maybe some labs. I would want some labs from you. I would want to know more about your diet, more about your other lifestyle. Do you smoke? Do you drink? You know, how late are you eating at night? Do you exercise at night? Do you not exercise? I mean, there's so many things that, no, I don't have any advice for you. I'm sorry. There's just not enough information for me to make an informed, to give an informed answer. Sammy, I don't know what you're struggling with, but I'm sorry to hear that you are, you know, that you've had an accident, and we will pray for you. We'll pray for your healing. When a number of people all pray together for one person, God hears us. God hears us all the time, but he really hears us when we're all mumbling about Sammy. Okay. Any questions? You guys are on Instagram are very, very quiet. What's going on over there? Help me out. Nobody has a question over there. I'm kind of going through all the people over there on Instagram. I'm live on Instagram and YouTube, YouTube right now. So, no questions. No questions at all. None. Okay, back to YouTube. What do we got for questions over here? Okay. Carrie says the planet has provided medicine since the beginning of time. I can't disagree with that. Yes, Jana, I agree. Power in prayer. Thanks for being here this morning, Jana. I appreciate it. Yes, Boo Boo, I am a doctor. Hey, Boo Boo. Family practice. Oof, Chris, that is a tough question. Chris asks, do you feel retroviruses are accidental or by design? Is there a cure? Again, great question. How I feel shouldn't influence you. You should be looking into this as well. But I do believe in order, or, well, that some people tell us that in order for science to progress, we need to develop things. Scientists need to develop things so they can see how it acts and they can see what antibiotics might affect it, or antivirals in this case might affect it. And so you could go both ways on saying, you know what? I don't really like this concept of gain of function, or I really think this is a great idea to do gain of function, because what if something gets out there and now we've studied it at least? Well, the other person might say, well, if we never had it out there, we wouldn't have to worry about it. So you can go both ways on this. Accidental or by design, again, how do these reverse old retro viruses start coming about? And are we feeding them with our diet, with the increased amounts of seed oils and sugars, so high carb diets? And, you know, I think there's something said that what we are consuming, that we're, consuming genetically modified not food. They are not food. They're, some influencers call them frankenfood, but they are not nutrition. They have no nutritional value. In fact, they had to be fortified in order to get on the shelf. And so if the things that we are eating could be feeding these viruses, these pathogens, the bacteria, the viruses, the parasites, the fungus. Just my thought on it, Chris. I don't have a real answer for you, but I'm just getting everybody maybe to think about your question. XQ says, what about physical movement? Low carb or carnivore is only part of the equation. I agree. It's about 75 or 80% of the equation. And exercise maybe being about 25%, but I believe everybody should move. Everybody should exercise. Everybody should do resistance training over cardiovascular, aerobics. They should be doing resistance training. They probably should include some high intensity interval training in that as well. Boo says, that's why I don't go to the doctor. Probably a good choice, unless you get your finger cut off or you need a hip replacement, right? Boo. Okay, first time in as long as I use cannabis, I no longer have to use a cane to walk. Yeah, mood elevator, I'm not sure what the mechanism of injury for your migraines and the cannabis is, or, the mechanism of action I meant for cannabis on migraines. But you might find that cannabis helps with your migraines, but why do you have migraines? Is it a magnesium problem? Is it a sugar problem? Is it a blood pressure problem? And yeah, cannabis might help a lot of things, but what is the root cause of why you have a migraine? And that's what I want you to dig deeper. Nina Teacolt's The Big Fat Surprise. That was the book it just came to me. That was the book that probably spurred me into thinking, whoa, has everything that I've been taught wrong, a lie? Yeah, that book, The Big Fat Surprise by Nina Teacolt's. That was a stepping stone for me. Sammy or Sam and Mimi, or just Sam Mimi, I'm not sure. What do you think about you getting psoriasis while mostly carnivore for 2 years? Something is causing the inflammation. I don't know, is your carnivore strictly red meat and ruminant meat? What is your meal look like on a carnivore diet or a carnivore lifestyle? What if you're taking in dairy? That can affect your skin. It's inflammatory. Lactose is inflammatory. There are casomorphines that could be inflammatory on your skin. If you are eating aged dairy or aged meat, that can cause a problem on your skin. So until I know what your carnivore diet looks like, it might be hard for me to decipher what is causing your psoriasis. Okay? But you have an inflammatory condition on your skin. And it's usually coming from the gut. Something that you are consuming gut-wise is causing the psoriasis. Most all skin conditions are in relation to our gut. So start working backwards and say, what is irritating my gut? What could be increasing the gap junctions? The cells in your gut should be lined up tight, body to body, okay? Cell to cell. If we get gap junctions in there because of inflammation and increased amounts of zonulin being produced or secreted, then we have inside stuff leaking out outside the stuff. And that's how we can get joint aches and pains or skin issues or whatnot, okay? And here's another thing that Sam says that really kind of makes me think is he or she said, while mostly carnivore. Mostly carnivore. What does mostly carnivore mean? I eat carnivore 1 day a week or 3 days a week or 4 days a week, and then the other days a week, I'm not eating carnivore? Or is it, well, mostly carnivore, 1 meal a day, but the other meal a day is not carnivore? What is the definition of carnivore? To me, it's 0 carbs, animal-based 0 carbs. That is my definition. So a lot of things to peel back here. Patrice, thank you again for your kindness and the super chat. I appreciate it. Thanks for sharing your knowledge. How often should one eat sardines per week? I eat sardines twice a week. I'll eat a can twice a week. I also eat albacore. I do too, but that's much more rare. I might eat a can of albacore once a week, or excuse me, once every 2 weeks. I don't eat much tuna. When I think about eating stuff in a can, besides sardines, I know I need the essential fatty acids, which are more of them. I know I need the vitamin D, which is more of it. Vitamin A, more of it. I just don't eat as much tuna. I do like it. I love albacore, but there's going to be more heavy metals in that, and I try to avoid. Okay? Yes, mercury, heavy metals. So are these good choices for a carnivore diet? I think if you like albacore and you like sardines, yes, it can be a great source, okay? There are a lot of carnivores who incorporate fish in their diet, and I'm okay with that. If you're okay with that, Patrice, are they as nutritionally dense as grass-fed organic ruminant, which is grass-fed, but cows, sheep, lamb, bison, buffalo? I don't think so. I think the most nutritionally dense food we can eat is ruminant red meat. That's my opinion. You might have another opinion, but if you want to incorporate dark meat chicken or dark meat turkey, go for it. If you want to incorporate pork, go for it. Okay? I don't eat as much pork, but my dogs eat a ton of pork. I mean, not a ton, but they probably eat pork 3 days a week. Everybody's different, okay? They'll eat chicken. I probably won't eat chicken maybe once a month. Turkey, I love turkey. I might eat that twice a year. It just depends on what you're used to or what makes you feel good, okay? Get your labs, get a baseline, and then you'll know how is it affecting Patrice on what I'm eating. If Patrice was eating a whole bunch of, carbs and she had diabetes, and 3 months later, her A1C is down to 5.4 from 6.4. She's off of medications. Her blood pressure's back down to 120/80 or thereabouts. And she's feeling like $1 million skipping down the street singing a happy song. I would continue. If you have been skipping down the street and you say, I want to incorporate some more fish into my diet, but over a month's time of incorporating fish, and pork maybe, you don't feel like you want to sing the happy song anymore, go back to the red meat and see. I mean, you get to know your body, Patrice, over time. You'll know what makes it work. When I'm deciding on whether or not I need to be consuming enough or too much fat, my body will tell me. And I might say, you know what? I'm starting to feel this and this. I'm going to back off on my fat. I think I'm getting too much. I back off, and I'm not talking a lot, but maybe 25, 30 grams I back off, and then I start feeling new again. So once you do this and mine is a journey, has been over the last 3-4 years. It's been a journey. I know what now affects me. If I take a tablespoon of peanut butter in my mouth, the next day I will have crampy gut. I will have joint aches and pains. And so I know, was that worth it? Was that peanut butter? It tasted good at the time, but the repercussions are not so good. And so I'd stay away from it. I get the same way. I tried to see if coffee did it to me. So I went off of coffee for a few days. And when I went carnivore, all my gut stuff improved. My joint aches and pains, especially my shoulders, improved. All of that improved. And if I thought about, let's just take coffee away and see if it made even more of a difference, it didn't really. I added it back and I got no symptomatology. Once you get really good at recognizing how your body reacts to certain things, you'll know, okay? And, I've had a lot of training on knowing what my body, how it reacts to certain foods, because I was in bodybuilding for 13 years. And I knew what my body reacted to way back then. And now that's helping me determine, when I got rid of plants, well, what plant can I add back and see if that was, causing some of my symptoms. I've tried it. I like to do those things, okay? I like to add tea back, in a day, and then the next day see how green tea affected me. I won't drink green tea. It's worse for oxalates and phytates than coffee. So I'm just not going to do it. Okay? All right. Robert, what is the best food to boost for your metabolism? I would say that you probably need to remove remove foods that are messing with your metabolism, okay? All right? It's not a food you can add. It's actually a bunch of stuff you can remove, and that will boost your metabolism. Getting sleep will boost your metabolism. If you're making sure that you're not in a calorie deficit. People, they get on these weight loss diets and they start limiting their calories. Well, guess what? At first you might lose some weight, and then all of a sudden you're shut down, completely shut down. Because when you start limiting your nutrition that your body needs, your body's going to start clamming up. It's not going to want to use any energy. So your metabolism, your basal metabolic rate is going to go down. And so you'll start to conserve and gain fat when you're not even hardly eating anything. So we're messing with our metabolism when we try to limit our calories. All right? Now, if you tell me that you're a morbidly obese person and you got a suitcase, 10 suitcases of energy sitting on your body, you might be able to get by without eating. But if for the general population, maybe that's not such a good idea. I have a lot of women, especially, who do not eat enough. They especially do not eat enough protein. They should be getting upwards to 100 grams of protein. Okay, and I'm not talking about protein powders. I'm talking about whole food sources of protein. And peanut butter is not a source of protein. It is a source of fat. It is not even a nut, okay? So nuts in general are not sources of protein. They are not complete, all right? So women are not getting enough protein. And then they're not getting enough fat. I mean, that's looking at between 150 and 200 grams of fat in that person. Okay. Oh, thanks, Boo Boo. Thank you for hitting the likes and hit the thumbs up, you guys. Hit the hearts and the thumbs up. And if you haven't already subscribed, subscribe. If you haven't already shared this to your other favorite platform, please do so. Share it to X or LinkedIn or wherever, okay? Good morning, Angie. Armand, I think you've probably asked this question before about your testicular pain, but you really need to get this looked into. You need to see your doctor, okay? All right? You likely need to get a ultrasound of both testicles. Okay. Hello, Odin. Thank you for being here. Linda says, I bought some lamb. How do you cook it? You can cook it in a pan. That's usually how I do it. I just sear it and eat it. Salt. I like salt. Let's see. I mean, Murphy says beef is the best. I'm guessing Murphy says beef is the best tasting for you, Murphy. But if something had a little bit more nutritional value, it would be lamb. Okay. Bozen says, I was told I have Barrett's esophagus. How do I heal my esophagus naturally? Oof. Bozen, that is a good question. And first, let's define Barrett's esophagus. Bozen likely developed Barrett's esophagus from a chronic problem with reflux. So Barrett's esophagus develops in the lower aspect of the esophagus, where the esophagus dumps into the stomach. And there's, at the end of the esophagus, before it dumps into the stomach, there's a little door, a little muscle. And he's called a sphincter, And that little sphincter is supposed to open. The door is supposed to open when contents come from our mouth down our esophagus and dump into our stomach. The door is supposed to open. And then the door is supposed to close behind the dumping of the food or contents. And sometimes that little sphincter door does not close. And it could be stuff we eat, peppermint, spearmint, spicy foods. It could be alcohol. It could be smoking. All of these things can disrupt that little sphincter, that little muscle, that little door down there, and he stays open. And then the contents that are in the stomach can splash up over time backwards. They're not supposed to go up into the esophagus once they're in the stomach. And that acid, which is between 1 and 3-ish in the stomach, splashes up into the esophagus where it can't tolerate that low of a pH. It might need 4 or 5 in that area. And so the acid pH of the stomach contents destroys the cells of the lower esophagus. And Barrett's esophagus is a pre-esophageal cancer. So most